Welcome to the next installment in AlertFind's webinar series. Today we are talking flu prevention strategies. Don't let the flu disrupt your organization. You can join the conversation on Twitter using the hashtags AFWebinar and Pandemics Preparedness, and we're going to be live tweeting at AlertFind.com. I'm so thrilled to introduce you today to Meg Nash, MPH, an emergency preparedness expert. Meg Nash is a principal consultant for Helion Solutions, is a seasoned business continuity professional with a comprehensive background in emergency response, disaster preparedness, and public health. She has worked with businesses to implement continuity plans for more than 10 years and has more than 20 years of experience in emergency management and response. Meg is a certified FEMA instructor and a highly rated speaker and presenter. She holds a Master of Public Health and a graduate certificate in emergency management and public health, both from George Washington University. Welcome, Meg. I'm so excited to have you back.
Thank you. I'm looking forward to this one.
Nice. And I'm going to be your moderator today. I'm Danielle Ricci, the Vice President of Marketing for AlertFind. Today we are going to be covering what we can learn from last year's severe flu season, actions organizations can take to protect themselves, what the flu season teaches us about pandemics, why businesses need pandemic preparedness programs, and what the 2018 flu forecast looks like. So I'm going to jump right in, Meg, with the first question, which is what can we learn from last year?
Well, last year we sort of had a heads up. So this would be the 2017-18 flu season, which flu season generally runs about beginning of November through middle of May. So it's kind of like football, basketball season with a little bit of hockey thrown in there. So if we talk about this time last year, we had the idea that the flu season was going to be pretty bad. We can usually watch what comes over, what Australia is experiencing, and see, because their season is before ours, we can kind of anticipate what that flu is going to look like when it hits the U.S. And, you know, we really had a sense that it was going to be a tough year, and it really was. We had a record number of children that had fatalities from the flu. We had lots of people that were infected. The other challenge last year was that our flu shot, even though we had some anticipation of what strains were coming, the flu shot was already in process by then. So the immunizations were a little bit off, and it wasn't as effective as it has been in years past. So even those people who got flu shots, they were a little bit less sick than they would have been without that. And we'll talk a little bit more in depth about the importance of shots. But, you know, we really had a heads up and tried to get more public awareness out there to make sure that people did get their immunizations and knew safe practices when they were sick.
So why was last year so severe?
So last year was a strain of the flu, and we know that the flu changes every year. It was one that has your body goes into a higher amount of immune response. So it was really tough, especially on people that were of like normal, healthy age that don't really have that big of a problem with it usually, that have strong immune systems. But it was just a strain that we haven't seen in a while. So most people didn't have any natural immunity to it. And since the flu shot was a little bit off, you know, it was just something that we were kind of dealing with almost cold once people were infected. There were also multiple strains going around, which, I mean, it always happens. If you go to the doctor, they'll tell you if you have a type A or a type B flu. Usually, though, geographically, you'll have predominantly one type. And last year, we ended up with a lot of mix of both A and B circulating at the same time. And if you get the flu with A, you can still get the flu with B. So it really was tough last year having all those going around at the same time. And we recently found out, probably within the last month, that the flu that we saw in Australia actually had time to shift its genetics before it actually got to the U.S. So even if it had been straight on preventative, if the flu shot had been directed at the strain that was so severe in Australia, it still would have been off a little bit here because the flu, it doesn't take much for that to change its strain and still affects people. So it was a pretty active little virus last year.
And so many people get the flu. Why is it fatal for some people?
So, we talk about the fatalities with the flu. Generally, the fatalities are from a secondary infection. So you can think if you've ever been sick and you feel like you're getting better, and then all of a sudden you get sick again. Kids predominantly will end up with, people will get bronchitis, develop pneumonia. When you get sick from the flu, you're actually injuring your lungs. When you're doing that coughing, it hurts, and you are injuring your lungs. So they're still healing as your entire body heals. And if there's happens to be bacteria or something that you're exposed to, it's a nice little place for it to get in there. So a lot of times that secondary infection, that the flu has already reduced your immune system and gotten you to the point where you're more susceptible. And then it's the secondary infections that really kind of creep up and wreak the havoc. It can help. It can cause swelling around the heart. Those secondary infections, like I said, problems with the lungs. We've seen people become septic, which is basically a blood infection that used to not be seen that often. We're seeing it more and more now. So we're not missing it as often in the healthcare system. It's something that has not been as, when somebody comes into the emergency department, you're not really thinking sepsis. And now that we're seeing more cases of it, they are being able to identify it quicker and treat it quicker, which hopefully will reduce the mortality associated with that. But the flu is it's really tough on your body. And if you have a compromised immune system, say from a cancer treatment, if you're elderly, if you've got anything that potentially may make you more susceptible, it's just that much harder on your body.
So what are we in for this year with the 2018-2019 flu season?
So I say this with a grain of salt. It's supposed to be a more mild season. That's, again, based on what we saw coming out of other parts of the world that experienced the flu the same way we do. And but that doesn't mean not to go get your immunization, because even if it's going to be a more mild flu, you're still potentially going to miss, school or work, potentially infect other people, especially within your house or your close friends. And it's still not something you want to have happen and deal with. So best to get your immunization, get it nice and early if possible. The CDC recommends by the end of October. If somebody hasn't gotten it yet, then there's certainly still time. And even if you've had the flu, you can, once you're recovered, you can still go and get the shot again, or get the shot the first time if you've missed it. Because like I said, there are multiple strains going around, and you can maybe prevent that next phase.
So what is it that's keeping people from getting the flu shot? I think we all know that we should.
Yeah, you've got some people that don't like needles. You have some people that just sort of miss the deadline and figure they'll just wing it this year. But you also have people that actually can't get a flu shot. So if somebody's under certain treatments for certain medical conditions, if you have somebody that's allergic to eggs, which is how they actually replicate the virus, to put in the vaccine, it's a dead virus, but it's actually the antibodies from the virus. So I don't want to scare anybody. You can't get the flu from the flu shot, but they have to grow those in an egg. If you have an egg allergy, you can't do it. And we're seeing a much bigger wave of people that don't want to, or that don't necessarily believe that vaccines can help them at all. And that's certainly a personal choice, but it does put a lot of other people at risk if they choose not to do that.
And when do we think that the flu season will be starting?
So there are a couple sites that actually track flu activity. We've already seen the start of flu activity. My daughter was in the hospital recently, and they wouldn't admit her because so many kids up on the floor all had the flu, and she did not. So they said, rather than you go up there and get the flu. So we've already seen, the start of it. We've seen fatalities in children already, and it's a little bit earlier than we expected, but it's certainly well within the normal time frame. And it continues on through the middle to end of May, depending on what the weather decides to do. So it's definitely we're definitely on the upswing right now. Usually we'll see it peak somewhere in January, February. It usually coincides with people staying indoors more, drier air, which makes your nasal passages. We all know how uncomfortable our nose gets when it gets super dry. It just makes it easier for you to pick up and keep those little germs. So that January, February time is really when we start seeing the height of the flu season.
And so now that we've talked about the severity of it, what actions should organizations be taking to ensure that they're prepared for the start of flu season?
Yeah, that's a great question, and I think as we see how these flu seasons have really affected businesses and organizations like schools, universities, I think we're all sort of realizing that there's more that can be done. We've heard for years, wash your hands, which ultimately is the best advice that anybody can give. But as an organization, you really want to start looking at what are those preventative things you can do? Like, do you want to host a flu clinic? Would that be something to bring somebody in to give flu shots to everyone? You may want to consider giving an incentive for flu. Or for flu shots, that if somebody goes and gets it, that there's they get some, a gift card or an extra hour of vacation or whatever it is. Because ultimately, the less sick time that they've got, the bigger advantage to you as an organization. You've got people there, you've got the continuity of everybody on site. You don't have half of your workforce that's either home or, taking care of somebody that's ill. But one of the other things that's really important is to, and it depends on the type of organization you have, but to understand what, are there any people within your organization that can't get a flu shot? So we've heard about this concept of herd immunity, that if enough people are immunized, then, the people that aren't immunized don't get sick. And that sort of gives a false sense of security and I don't need to get a vaccine because everybody else does. But for those folks that really can't get a vaccine, it's critical that the people that are around them on a regular basis are vaccinated so that they can't get and spread the germs to that person. Often they've got a serious medical reason why they shouldn't get the flu in the first place. So we really want to protect them as much as possible. So organizations can poll. They could do it through their HR. They could do it through whatever mechanism they wanted to. They could have their managers do it and see how many people are not able. You don't have to ask why, but how many people are not able to get a flu vaccine. And then you kind of get a sense of, okay, I've got 30 people out of 500 that can't get a flu shot. Then, I really need to make sure that the rest of my people have gotten it so that I can protect all of them. So looking at it that way, an organization can really be proactive and try to get their vaccination rates up as high as possible. The other thing that organizations can do is start thinking about what's going to happen when people do start to get sick. What am I going to be able to do to help them? But what am I going to be able to do to keep my organization flowing? If I've got 25, 30% of the people that are just out with the flu, that can take you out for a week. That makes operations really disjointed. So kind of thinking through what that looks like. But on the flip side, you also don't want somebody that's sick coming to work. So looking at what your sick policy is. If it's going to be a bad season like last year, I know some organizations decided that they were going to reset sick time, that people did not, if they had been home with the flu or taking care of somebody, that they didn't have to use up sick time. There are other organizations that actually, and we'll talk a little bit about this, but how long you're contagious, sometimes you're sitting there like, I could go to work. Why am I sitting at home? Really thinking through that what should our sick policy be, and then can I let them work from home and not take sick time? What are those alternatives? Who can work from home? I think we'll talk a little bit about one of the best things that you see, and you see this in a lot of places now, is any place that there's that there's food consumption, putting a hand sanitizer station there to remind people, oh yeah, my hands should be clean, I'm about to go eat. Same thing outside of bathrooms. So everybody hates to touch the doorknob or the handle on the bathroom door. So rather than, everybody using extra paper towels to get out the door, putting a hand sanitizing station outside that helps to reduce that transfer of germs on those hard surfaces. So there are lots of things that they can think about. If you're a smaller organization, just finding out as simple as what flu clinics are near you. Your local health department may have a flu clinic that you can say, okay, everybody, you can take 2 hours off this morning, go over and get your flu shot, and then, bring your card back and, however you want to incentivize it, but really thinking from an organizational standpoint, what's that impact going to be if I start losing people for a week at a time? And then how many people do I need to keep my business going? How many core people do I need here? And making sure everybody understands that what your sick policy is. If you're really going to tell people don't come in to work if you're sick, you got to enforce it and you've got to encourage it, and you can't make it a punishment if they're taking time off. So it really has to be something that you embrace at all levels so that people will abide by it and ideally keep their germs at home where they should be.
And this is an idea that you touched on a little bit at the beginning of this answer, but for larger organizations, should they consider offering the flu shot at work with a flu shot clinic?
I think it's definitely an advantage. It takes out that challenge of, when am I going to be home? I don't have enough time to do it. If you've got kids, you've probably got activities and things like that. If you're not going to a doctor already, you're not going to stop in during flu season or the beginning of flu season to get a shot and then be exposed to whatever else is sitting in the waiting room. So this really, and it also gets at sort of that groupthink idea of almost peer pressure of, well, if everybody else is going to go do a flu shot, maybe I should get mine too. And really seeing that other people are embracing this and are concerned about their health. It's also a really nice thing if you're one of those folks that can't get a flu shot to see sort of that support from both your organization and your coworkers to say, wow, they are taking this seriously and I feel comfortable coming to work. I just saw all my coworkers go get a flu shot. So I think that's a really good message, and it emphasizes the organization's commitment to health and wellness for the employees. Certainly something that can be offered to their family members as well if they wanted to. And it can be as easy if you've got an organization that already has health professionals. That makes it super easy that they can administer those there. You can also work with a visiting nurses organization that can come in and administer the shots on site. It doesn't have to be, you don't have to train your HR director to give shots. So you can certainly do that. You can work with your public health department and say, hey, we'd like to have a flu clinic. We have about this many people. Would you be willing to come over and administer those? The public health department has public health nurses that can administer those, and they do that at the health department. So it's just a really nice sort of capstone of saying, here's our commitment to everybody staying healthy.
Awesome. And for those locations or for those businesses where it doesn't really make sense to hold a clinic at the office, how can they find flu shot availability locally?
Well, thank goodness. I mean, this answer is so much better than it used to be, because probably about 5-7 years ago, your insurance had to pay for the flu shot. If you didn't have insurance, then you couldn't get, you'd have to pay for it out of pocket. Even then, if you had insurance, there was a copay, which was a barrier to some people to say, right before the holidays, I'm not going to go drop $30, $50 on a flu shot. I'll deal with it later. So on your screen, you're probably seeing the Health Map Vaccine Finder. This is a site that the government has put together as far as where they're administering vaccines. This could be a minute clinic at your local Walgreens. I think that's Walgreens is pulled up there. It may be something like you're at a grocery store where they have pharmacies. It could be any number of things. And you can also see on the right-hand side they'll show you more than just flu. So if lots of our kids have to get a Tdap shot before they go into middle school. So you can just use this to pull up anything that you're looking for, and it'll show you those locations. Most of us these days, I think, every time you go into a drugstore or the grocery store, there's a sign out that says free flu shots. Now insurance covers it completely, and if not, there are programs to ensure that those are available to people. The health departments readily give away flu shots. And this year, I was involved in our flu clinic. Last year, we gave out 300 doses in about an hour and a half. This year, we had 500 doses, and in 6 hours, we still didn't get rid of them all. And I think that really speaks to the fact that it's much more accessible to a lot of people. So people are getting much more used to saying, oh, I remember where I can go get it, and they have access to it. But if not, or they need some idea of where to go, you can also see on here that you can call an Uber right from this app. And I think, Danielle, I think you were the one that mentioned that Uber had a health service in certain areas. I know they had them abroad, and I think you said they had them out in the Bay Area where they'll actually have a nurse come in an Uber and administer your shot, and then off you go. So, I mean, anything we can do to really make it more accessible to people is a great thing, and it's really helpful to the entire community. But as an organization, I would probably look here and say, who's the closest one, and figure out how to get my people over there and make sure that everybody that needs one or wants one has access to it without too much trouble.
And so I think that you mentioned earlier that we're already a little bit late this year for getting your flu shot, but what's the ideal time to do it?
Ideal, like you said, the CDC recommends by October 30th. Halloween is always a great reminder to just say, try to get your flu shot by then. Some people will wait a little bit longer. They'll get it a little bit later in the season. Doesn't really matter when you get it, obviously, ideally before you have the flu. But you want to get it as early as you possibly can. I would certainly try to have it in November sometime, if not, as soon as possible. And like I said, even if you get the flu, you can still get the flu shot after you've recovered, because it gives you that much more protection against other strains that may be going around, so that you don't catch the next one coming around. I have been unfortunate in the past to catch 2 flus in the same season, and it is not fun. So it's a good thing to get on board as soon as you can.
And how does flu season play into pandemics?
Right. So a pandemic is really a large-scale event where we're seeing lots of people infected with a virus across multiple areas. They're not geographically connected. It can be on different continents, different states. Really, just it's an overwhelming infection rate. Flu is a very likely candidate for a pandemic. So when we had H1N1 back in 2009, and I think we're going to talk about that a little bit more later, that reached pandemic levels. It didn't affect the U.S. as much as we thought it was going to, but certainly the rest of the world were experiencing high infection rates from that across the flu prevalent areas. But pandemics are something that can have far-reaching effects economically, socially, well beyond healthcare. And there are lots of considerations to how you handle business and social events and gatherings and school and church when you do have a pandemic, because it's that much more likely that you're going to have people infected that can transmit it to somebody else. So, in the bioterrorism world that I spend some time in and emergency preparedness, pandemics are just a natural occurrence. They're going to happen, but the likelihood that a pandemic is going to be a version of the flu is pretty high. They really are. It's just something that's so easily transmissible from person to person. We tend to be very susceptible to it. So if you're exposed to it generally, if you haven't been vaccinated or, it's a completely different strain, the likelihood of you getting it is pretty high. And it doesn't take that much of the virus to make you sick. So One of the easiest way to transmit the flu is actually droplets in the air, which is really disgusting to think about. But that's, somebody coughs or sneezes, those droplets can actually just hang in the air. They're small enough, and that doesn't mean anybody should stop breathing, but it's just, it's not always the hand washing. Sometimes it's as little as, somebody sneezed. So really is something that's so easily transmissible. So public health folks are always watching what's going on around the world for flus and anticipating what that means for the U.S. and our travelers and people living abroad and working abroad, and what the best preparedness measures are to keep them safe. And now we're really starting to look at that whole culture of preparedness with businesses as well in the private sector to make sure that they're aware of what actions they can take, because everyone that does that really helps to minimize the amount of the spread and helps protect, the most vulnerable people in the country.
And so how should we understand the financial impact of flu season on businesses?
Yeah, so it's really a challenge. We've gotten a little bit better at working from home, that continuity of people, being able to still contribute to the organization while they're at home. But there are only certain types of jobs that can do that. And certainly, as the picture shows, most of the time, if you actually have the flu, you're not going to be able to work. You're going to feel absolutely miserable. So as an organization, you really have to look at if, average, it's about 20% of the people 20% of adults will get the flu every year, with our average vaccine rates. So if you just want to look as an organization and randomly take out 20% of your population over the course of 2 or 3 months, and look at what that's going to do to your whatever your processes are. It's one thing if you're doing things that are more computer-based, like I said, people working from home, or can be further apart from each other. We call it social distancing, where maybe you skip every other desk and have people spread out. You use conference rooms that are, people can spread out more rather than sitting right next to each other. But it really, an organization has to look and say, well, what's it going to do to me if I start losing people? And you have to think that they also have families. So there are going to be times when they're taking care of a child or a sick grown-up or a partner. So that's really a big consideration. And I think the estimated loss of productivity every year due to the flu is in the billions. I believe it's almost 7 billion. And it's just astronomical. And that's just in the U.S. of productivity that is not happening just because the average amount of flu infection. And so you can imagine if it's a really severe year, that number is going to go up dramatically. Now, if you have an organization that's highly dependent on people being physically present, so you manufacture things, you've got a service industry where you've got to have people working a counter or a desk or something like that, then you have to think that, if those people suddenly aren't there, what are your options? And some organizations have gone to doing shift work, even when they primarily don't, and that allows far fewer people to be there at any one time. Sometimes that's an option, sometimes it's not. But really to take a deep look at your organization and think, what's the biggest impact going to be, and what can I do in the meantime preventatively, and then anticipating that those folks are going to get infected and be out of work. Certainly if there's a severe pandemic, then you're going to be looking at potential fatalities and loss of workers. And from just a purely business side, that has huge impacts to an organization, both from their morale, their organizational psychology, and then also when you start thinking about having to replace somebody that has institutional knowledge and was productive. So a lot of those considerations. But during a normal flu year, I would say the biggest thing is to just anticipate what that's going to be, decide how you're going to manage your sick time, how you're going to enforce it, how you're going to communicate that, and then put on your seatbelt and hope for the best.
And what are some ways that organizations can, track the impact of the flu and, their own employees? sick time?
Yeah, I think it's really important for organizations to, when they're talking about their health policy and communicating that to their staff, I think it's really important to be able to tell them, reinforce what the sick time policy is, but then also tell them that you're going to ask that when they're home sick, you'd kind of like to know why. And without betraying their confidence, what you want to do is maybe have a manager at the managerial level, whether it's a project manager or like a staff manager, say, I know you're homesick. Do you have the flu? And at that point, you can start gathering data. If somebody's home to care for somebody with the flu, you may want to look at that as well, because that'll give you data for the following year to say, look, my folks, everybody got vaccinated, but it turned out I had, a 30% absentee rate because people were home caring for somebody else. It may just be the nature of the employees that you have. So taking a look and letting them know that you're going to be asking if you're out with the flu, we'd really like to know. And just keep that data aggregated. It doesn't have to be identified as a certain person, but that if a manager can just say, look, in my department over this time period, this time card section, I had 18 flu days of sick time. And then that helps you may as an organization have a high, depending on where you live, you may have a high flu infection rate on a normal basis. You may have older workers. You may have, you may be in a colder climate where maybe the season lasts longer. So what that does is it allows you to plan for the following year. And I've seen organizations, instead of giving annual sick time, they'll give seasonal sick time. And that's certainly a consideration if you know you're going to have a higher level of incidence, that, you may give extra sick days during flu season, or you may give, sick days that don't count if they have a doctor-confirmed flu infection, which is super easy to do. The Minute Clinic doctors, they all do it. So with the prevalence of antivirals, so we've seen a couple that have popped up on in the market over the last probably 5 years, 10 years, but they're getting far more common. So now people are more likely to say, oh, if I have the flu, I'm going to go into the doctor and get a prescription for an antiviral that hopefully will minimize how sick I get. It's not going to make it go away, but it's going to minimize how sick I am and how long I'm infectious. So they're also more likely to be able to go and get that confirmation from a doctor that says, yep, I had the flu, here, now my sick days don't count. Something as simple as asking a doctor to write when they should be going back to work. And then the organization can plan for that accordingly, and take that into account and say, look, we know the flu is serious and we really don't want you here. Flu days don't count if you've got a doctor confirmed note. However you want to do it. But it's really important to kind of get a handle on why your employees are out. The schools do it. The schools want to know if somebody's got a fever, they've got an intestinal thing, because they really want to anticipate what the impact is going to be to the rest of the school as well, and track those things.
So what can we learn from the H1N1 flu variation in 2009?
Yeah, so that was a really interesting one. Lots of people may remember it was called pig flu or swine flu. My kids like to call it pig flu. And it was basically an avian flu that combined, basically two flus combined on a farm with livestock. And the strain that sort of, if you think about mixing up, I don't want to say Diet Coke and Mentos. That's a bad image. If you think about mixing two different colors of paint, red paint, blue paint, the color that comes out is purple. Well, pigs are really easy to combine human viruses with other viruses. So they're sort of like the perfect paint pot, if you will, to combine these viruses together. So in went a human virus and this avian virus that we normally don't get, and out came the purple paint. And it was something that was so different than what we had seen before, that it was highly infectious. and it was very different from previous flus. So people may remember the 1917-18 influenza called the Spanish flu. It was called the Spanish flu because it was discovered, I believe, in Mexico City, but it was actually brought there by Americans. So it should be the American flu. But it was a flu that had tremendous effects on World War I. Lots of soldiers succumbed to the flu. We had major events. It was also an election year. So there were lots of large gatherings, war bonds, the whole 9 yards. And it was a flu that, since we hadn't seen it, had devastating effects. And what those two flus had in common was that it wasn't the flu necessarily that killed you, if you will. It was your body's immune reaction to it. So normally we think about the flu and it's, the very young, it's under 5 years old. Especially under 2 are the most susceptible, or seniors that are 65 and over, or people that just have a poor immune response for whatever reason. Those are the folks we worry about during flu season. This flu, however, H1N1 in 2009 and the Spanish flu, what they did was this flu made you react with your immune system. So anybody that's had an autoimmune disorder can vouch for all the things your body can do to itself when it has too much of an immune response. And what happened with these two flus is that it attacked that healthy group that had a good immune response. So the healthy kids, the people in their 20s, 30s, 40s, people that were marathon runners that ate super healthy, they were able to have such a strong immune response that that's what was too much for their body. So it's really kind of weird to think about that your body can do that, but it just sort of triggers this overreaction, and that's what killed people. And that's why we saw just such a difference between those two. Now, the interesting thing was, and they kind of figured this out, is that people that had lived through the Spanish flu when they were kids were also far less likely among their peer group to get sick from the 2009 flu. So obviously they were very old. They were already in the elderly category of, didn't have as much, but they definitely still carried some immune protection from that flu before. The way just real quick, the way your immune system reacts to things, if you actually get the flu, it's like your body writes this little blueprint and says, all right, here are our plans next time we see this, files it away. Next time it sees that, it says, oh, we got the plans, here we go. So that's sort of how the immunity works. Since the flu changes so often, sometimes that helps, sometimes it doesn't. When you get a flu shot, it protects you for a while. It's almost like they sent in temporary workers to fight off your flu. But once that wears off, the temporary workers go home and you could get it next time. So a little bit of that stays around year to year, but for the most part, once you've had something and gotten sick, you'll carry that immunity with you for a long time. So really what we saw here is people carrying that immunity all the way from the early 20th century, almost 100 years later, to the H1N1. And that's really our biggest concern from an organizational standpoint and from a business standpoint, is that if we have another flu that is widespread, that is what we call novel, meaning that it's not something that we normally see on a typical flu season. We haven't seen it in a long time, or our bodies have never seen it, so nobody has those blueprints in the drawer. Then that potentially can take out our healthy workforce. So no longer are we worried about necessarily the very young and the very old, which severe illnesses tend to prey on, flu or otherwise. But it really would target the heart of our economic base of workers. So that's definitely something we've learned lessons from it, and we continue to analyze what could have happened differently, and looking at flus that we see circulating and anticipating which of those could combine potentially to cause a much more serious response.
So what are the odds that our next big pandemic is going to be a flu variant?
I think it's a pretty good. I think it's a pretty good chance. Definitely better than even. I'd probably give it double odds. We see a lot of crazy things going on in the world these days, so there are certainly other options. We saw Ebola into the United States for the first time ever. While that's a virus, it certainly is not a flu. But we never really know what's coming next. We saw Zika, again, not a flu, but it is a virus. So there are other things that could cause a pandemic, but they're also really difficult to transmit from person to person. What the flu has going for it is that it's so easy for those drops to hang in the air and just wait for somebody to breathe it in. We touch our face multiple times every minute. So the likelihood that you touched a surface that had a virus on it and then touched your face is pretty high. And then you also potentially can transmit the flu when you don't even know you're sick. Or you decide you feel better, you can go back to work or go back to school and you're still infectious. It's just so easy to spread that around between people. And that's really what make the ingredients for a pandemic. So I think as we watch some of these flus change, as we watch the climate change, we're seeing areas where certain things normally would die off in the normal climate. Now that the climate has changed, it's become wetter, it's become, whether it's warmer or colder, it really throws those traditional patterns that we've seen for disease, it kind of throws those out the window to a degree. And we have to anticipate that that's going to continue to happen as our climate keeps changing, as we rapidly are able to move to travel internationally, and do a lot of those things. It's much more likely that we're going to pick something up and be able to spread it around really, really quickly. So I would put money on it that it would be a flu.
And is there anything else you want to touch on about the transmission of the flu, whether it's, how it starts or, the human to human transmission?
Yeah, I mean, one of the biggest things that we tend to forget. Oh, look at the chicken. I have chickens. And they're actually very cute when they sneeze. But the whole thing with the transmission is that we as humans live in the perfect environment to transmit the flu. A lot of us take public transportation. We go to schools. We go to grocery stores. We're always in groups. We're social creatures. And that's really where this transmission idea comes from. The other thing, too, is if you're in a movie theater, and again, I'm not advocating not going to movies, but if you're in a relatively crowded, enclosed space and somebody's sick, the likelihood that they can infect more than one person is pretty high. They don't really need, how many times could they sneeze? So, it really becomes that the perfect grounds for it. And I think what we need to do as a society, especially in the U.S., is take a step back from our traditional, no, I've got to work, I have to be there, I've got to go, they can't do this without me, or, I'm going to look bad if I'm weak and have to stay home. I think as organizations, we really need to push that concept of wellness and health, and figure out how we can work that into our organizations. I'm not saying, give away the farm and go bankrupt, but really looking at how do we encourage that level of health, so that we're not continuing to propagate these perfect environments for transmitting. And I think working with whoever's doing our cleaning within a facility, working very closely with them. I know I worked in one place where we started using wireless keyboards, and you always took your keyboard with you. You had a pen with you and you had your keyboard with you. You didn't touch anybody else's keyboard or mouse. You didn't touch anybody else's pen. And even just something as simple as that really helped, giving everybody bacterial wipes so they can wipe down their desk. They can wipe down their keyboards. They can, remind them to wipe down their phones. There are just lots of things people can do. And then if you've got a cleaning service, lots of things that they can do that really can help remove some of those transmission barriers or those transmission sites where you've got people congregating and there's really not much else you can do but try to prevent those from spreading.
And what are some of these flu preparations that you're suggesting that can be, used for other diseases or pandemics that an office might face?
Yeah, I think communication is a huge one, and not just because we're on an alerting webinar, but communication is huge. Being able to let people know that somebody has gotten the flu within an office. Really deciding how are you gonna attack this as an organization. I've said over and over about really creating that culture of health and wellness, but beyond that, helping people understand what their own personal preparedness should be. So we emphasize hand washing and things like that. But going beyond that and talking about what people can be doing at home or in certain areas, let them know that the thing that applies to kids in school is you can't come back to school until it's been 24 hours without medication since you had a fever. Well, there's no reason that shouldn't be the case at school or at work as well, and even more so since we're talking about economic impact as well as social. And then looking at what those support procedures are of if somebody's got to stay home with a sick person, how is the organization going to support that? But the biggest thing is really communication. What information are you going to give to them? What information are you going to get back? How can you connect them to, quote unquote, the experts? So whether it's the CDC, the World Health Organization, the CDC has a little widget you can put on your website. You can put it on your intranet. That's like a flu report. So that's something that I know they started it during Zika. I'm pretty sure they have it for the flu that lets you know kind of how the flu is going. Every week they put out a report. So I think that's one of the big things is just making sure people are aware of what they can do, what you're doing as an organization, and then how to how to best support people in caring for themselves so that they're not bringing it into the office and spreading it around to everyone else.
And you've brought along some additional resources here that, as we're closing out this webinar, that you might want to suggest to people who are worried about the impact of flu on their organization. So is there anything here that you want to especially highlight?
I would say that the FEMA's pandemic influenza template has some good resources on there. The WHO, which is the World Health Organization, their pandemic preparedness. Again, this is going to be talking about flu, but there's a lot of information of anything that's going to be human to human transmissible will respond. There are a lot of preparedness tips, things to consider in there. The TED Talks are always great. So the one that's listed here is certainly worth your time to take a look at. You can Google flu and continuity, influenza and continuity. There are lots of resources available. If you want to start looking at how do I create a policy around work from home when you're sick, you can certainly Google that and come up with lots of suggestions. And then there are, the vaccine finder that's listed at the top again is that government listing of the location for not only the flu vaccine, but of the other types as well. And the one thing I want to say about that is I think it's really important if you're getting later in the season and you haven't gotten your flu shot. I know last year people had kind of blown it off, and then once it got really bad, they started to scramble a bit, and there weren't a lot of flu shots available. So a resource like that certainly helps to make it, to be able to find it and make sure people get connected to the services and the vaccines that they need.
Great. Thanks, Meg. So now we're gonna open the floor up to questions. If anyone has a question for Meg, you can drop them into the chat box in the GoToWebinar interface, and we'll answer them as they come up. And I've already got one. So Meg, should businesses give their cleaning companies additional direction during flu season?
I certainly would. We tend to think that they're going to know what to do, but it's our organization that's going to have sick people and downtime. So it really is important to have that communication and make sure that they understand what you want them to do. So, there are a ton of different things, but when we're talking about cleaning particularly, there are lots of things, not just surfaces that we normally touch, but but other things that we need to make sure are clean. So when we talk about break rooms, it's incredibly important to have, the antibacterial soap, and we talked about the sanitizer, but making sure those break rooms are cleaned thoroughly. If you want to go in and sit down, you're probably going to put your hand on the back of a chair and sit down. How often is a cleaning company going to be cleaning the back of a chair? You look at things like cleaning desktops, and we'll think, oh, well, I need to clean my keyboard. I touch that all the time. Well, how often do you clean your phone? So if you still have a desk phone, how often do you clean that? Making sure that those things are added in. If you've got any sort of equipment or countertops that are used for assembling things where people are actually doing work on, like on a plant floor or something like that, that's certainly going to be an area that everybody's going to be touching. You want to make sure that that's clean. And it's also a great idea to have things like masks, paper masks, and things, even gloves if you wanted to, available to your visitors as well as your employees. So if somebody feels that they, want to be protected, or they know that they're a little bit sick but had to come in, it certainly gives them an added level of protection. You can also look at providing like the disinfectant wipes and germicidal wipes, having those left around. And then we really want to think about what options do we have for no touch. So if we've got, the no touch soap, seems a little ridiculous, but if you think about it, you're not transmitting any germs, you're just getting your soap. Same thing with garbage dispensers or garbage receptacles. Anything you can do where you're removing it from touching. If you actually do cleaning as part of your organization, things like making sure that the mops and all those things that you put your hands on in the course of a day are thoroughly cleaned as well, and your cleaning company should certainly be able to help with making sure that those things are taken care of.
Great. So one other question is, do you recommend that overseas travelers stay home for a period once they've returned before they come back to work?
So as far as the flu goes, and every every virus and spreadable thing is different, but specifically talking about the flu, you're only really infectious with the flu about a day before your symptoms start. So, I think it maybe people are going to have jet lag anyway, but it would really be up to the organization. If you have a lot of people that travel, if you've got a consulting organization or something, or banking, anything where people are going back and forth from abroad, you may want to consider a sort of a holding period when they get back. But again, if you have the same person that's traveling constantly, that's not really that may not be efficient. So making sure, I would probably work with a local infectious disease doctor and say, right now, when this person is going to travel, make it part of the travel process. What's the biggest concern right now of things that are going on in the area that this person is going to, and then make a decision based on their location. So if they're going to be going somewhere where, Zika was highly transmissible, just for their own safety, what precautions would you take when they came back? But I would do it based on the location that they're going to and what those current threats are. And infectious disease doctors work on those constantly, especially if you can find one that does tropical medicine. They'll know exactly what's going on there and be able to advise you of if there's anything of concern and what their recommendation would be.
Awesome. Well, thanks so much, Meg. I think that's it for questions, unless somebody's got a last minute one. But this was really, really informative. So what I've taken away, Meg, from this and from every time I talk to you is touch nothing. Never touch anything. Yeah.
Answer yourself, exactly. Just like kindergarten.
Touch nothing, get a flu shot. Awesome.
Exactly.
Thanks so much. I really appreciate it. If anyone has any additional questions for Meg, her contact information will be a couple of slides from now. You'll also be able to reach out to her. We'll be sending an email tomorrow with the recording of this webinar and some ways that you can get in touch with Meg. and those additional resources that she recommended. AlertFind is an emergency notification system for business continuity professionals. You can see it in action by scheduling a demo through our website, alertfind.com, and then just hit the request a demo button that's at the top of every page. We'd love to chat with you. And we'd also love to see you next time. We are going to be talking to Bob Clark on December 13th at 2 p.m. Eastern Time. And the topic will be Making Social Media Work for You, Crisis Communication Strategies. And this will actually be the last AlertFind webinar of 2018. So after that, you're going to have to wait till 2019 before we see you again. You can contact me, Danielle Ricci at aurea.com, or you can reply to any of the emails with the follow-up recording. Thanks, everyone, for coming.
Thank you.